It's Caitlin Filio here at Senders Pediatrics. As you've probably noticed, being 3 is associated with many changes as your child transitions from being a toddler to being a big kid. This can be such a tumultuous time that some people have coined these guys 3-nagers, a sign of things to come 10 years from now at the next big transition. At the checkup, we'll ask you the usual questions about things like nutrition and sleep. At this age, we usually try to include your child in answering some of the questions too. We know that a 3-year-old can be honest to a fault and that their answers may also not be entirely accurate, but this question and answer time offers us valuable insight into things like speech and language. More importantly, it begins to establish a relationship with us as their provider, a relationship that we hope will span the next 20 years. We will talk a lot about temperament at this visit, how to deal with defiance and attitude, but also how to nurture a quiet, more mellow child. We'll ask about things like potty mastery and constipation, as well as brushing teeth, and we'll want to make sure that your child has been to see the dentist or has an appointment scheduled. We will want to make sure that your child has lots of opportunity for physical activity. Organized sports are not as important at this age as having the chance to just run around outdoors. We'll talk a lot about screens. While some screens are educational, we will encourage you to not use screens as a substitute for personal contact. At this age, the more present you are, the more you talk, listen, read, and play, the more your child will learn about his or her world and how to interact with others in a socially adaptive manner. Even if you only have a couple of hours together on weekdays, it's the quality of the time together that matters more than the quantity. One great place to practice learning and playing skills is at preschool. We'll ask if your child is in preschool, and if so, how it's going with the teacher and with other kids in the class. If your child is not in preschool, we will encourage you to find activities that support his or her learning type. Extroverted kids need active types of activities, while more introverted kids need activities that allow them to shine in a more individualized manner. We'll also suggest that you begin a lifelong program to teach kindness and gratitude, as both appear to be strong predictors of happiness and resilience later in life. We ask you all of these questions so we can get to know you and your child better, but we also welcome your questions too. Parenting is not easy, and we want you to feel equipped and empowered to be the kind of parent you want to be. As you know, a well visit includes a full head-to-toe exam. This does include checking private areas, and we'll talk to your child about body safety and when and where it's okay to get checked and when it's not. During the visit, your child will get a vision screening with an electronic test called PediaVision, which requires brief eye contact with a piece of equipment that lights up and makes noise. Most children pass this vision test, but those who don't are referred to a pediatric ophthalmologist for a formal evaluation. Finally, most 3-year-olds are not due for any routine vaccines at this visit unless they need their annual flu vaccine. Please make sure to bring any preschool or other forms to your visit that you need us to fill out and sign. We look forward to seeing you.